Miaka imepita 10, lakini nikiwaza hiyo kitu inafanyika, inaonekana kama yenye imefanyika jana. Inakuwa ni huzuni sana. Yaani mimi tu ndio huyo naonekana the whole world nikifanana hivi. Nilikuwa nimekata tamaa, sina wa kunisaidia, mimi niko tu peke yangu pale. Hapo nilikuwa naona tu mauti. Kukaambiwa ya kwamba ukisikia uchungu iko imezidi, ukuje uingie huku ili wakushughulikie. Nikienda ninafukuzwa. Nilishindwa kabisa na nikaanguka kwa floor. Nilijaribu kuita, hakuna nasi aliyekuja. Fahamu kurudi nikisikia kelele nasi yao wanagombana, ni vita hapa chini. Nikalazimishwa nibebe huyu mtoto, nikalazimishwa nitoe hizo vitu zenye ziko chini.
The Tuesday night expose by KTN of patient negligence at the Bungoma District Hospital revealed how nurses at the hospital stood by and watched as a woman in her last stages of labor wriggled on the floor with her baby halfway out.
Josephine's case is an example of the abnormal that has been normalized in healthcare system. It is now called obstetric violence. When rights of those who are seeking care are violated, nobody wants to subject herself to subsequent violations, so then people avoid seeking healthcare. It then defeats the whole purpose of then strengthening the health system. And the worst of it all is that it is a gross violation of fundamental human rights. It is indignifying. It is discriminatory.
Josephine was lucky because she had someone who is aware about her rights. But many people don't know their rights. So even when they are abused in the hospital, they never report, they never do anything. Patients' awareness, rights is one of the SOPs in government and private hospitals. But now, people to adhere to those rules is a problem.
The Court of Appeal has added more weight to the decision of the High Court, saying that it is the responsibility of both national and county government to put in place systems, policies, structures, and protocols that will guarantee every woman seeking health care, including maternal health care, that positive experience. And for us, that is the value that has come out of the 10+ years of pushing for this case.
Kila mara nimekuwa nikienda kotini, sijakuwa nikisikia mzuri. Nilikuwa at least nataka hawa nurses walio na tabia ya kudhulumu wagonjwa wajifunze kwa kitendo kilichotendeka. At least wafanye nini? Warekebishe. Sababu watoto wanaozaliwa ni generation ya kesho.
I think after that, a lot of change happened to nurses and midwives, and also I'm sure even the mothers have seen the changes. The only thing is to make sure the attitude of healthcare workers change to the better, to love their patient. and show them empathy in whatever situation, whether she's clean or she's dirty, whether she has resources or not.
Ningepoteza maisha, ningekuwa nimesaulika. Hata huyu mtoto wangu labda ningempoteza. Singependa mtu mwingine apitie hali kama hiyo.
You could take the case of Josephine Majani and situate it in Tanzania, Zambia, Malawi, Nigeria, and you will find the same case of girls or women experiencing undignified treatment during pregnancy or childbirth. It reveals several systemic and structural challenges that we continue to experience in the continent. First of all, it reveals that there are legal, policy, and administrative gaps. Secondly is the lack of prioritization of healthcare services. This at two levels. One is the financial allocation that is increasingly limited, thereby affecting commodities at these facilities. And number two is the attitudes of the healthcare providers who are increasingly violating or perpetuating the mistreatment and dignified services to those women and girls. Third are the weak accountability mechanisms when these violations occur. The Court of Appeal in Kenya restated that maternal health rights are minimum core obligations of the state. What does this mean? It means that the African states, including the mechanisms for addressing human rights violations, need to have constructive dialogue to address the increase of maternal health violations in the continent. Finally, as the Center, we remain committed to ensuring that we call attention when these violations occur. We are committed also to working together with our partners, civil society, including member states, to be able to expound on norm standards that will address questions of maternal health rights in the continent for the benefit of our women and girls.